Good morning, colleagues. And I can tell that last night has still had its effects. I warned you that Trinidad does things with a particular flair, and I'm certain there was no disappointment from last night. Thank you, Alicia. So, again, I just want to say good morning to all. ParlAmericas, again, has launched a new booklet. It's in all of the languages that covers the region. And this booklet deals with multi-party caucuses for gender equality, a handbook for parliamentarians. This is also available online so that you can get your parliamentary colleagues and other interest groups who would not have had the rare opportunity to engage directly to still follow the work of this very important organization. The booklet covers many areas. It defines the objectives, among which is the formation of multi-party caucuses for gender equality, building solidarity among women parliamentarians in the legislature, promoting women's representation in politics, mainstreaming gender in parliamentary institutions and procedures, and drafting relevant laws for reforms along those lines. Very important work. It's a very good handbook for parliamentarians to follow. Keeping in the great tradition of ParlAmericas, the handbook is very easy to follow. And it makes for really quick reading because, you know, we parliamentarians are accustomed to voluminous reading of official documents with all kinds of statistics and numbers and votes and, you know, but the way these booklets are done is for quick condensed reading so that in a short period of time you can essentially internalize all of the main points and so on. There were, I believe, four particular studies in this handbook, and it's all laid out there, regional cases for the formation of these gender-focused caucuses. There's a regional study done on Costa Rica, a group of women members, Ecuador, sorry, not four, but three, Ecuador, and Grenada. And so what's the Grenada gets, what you say, you always leave the best for last, so I guess that's why the Grenada study to crown it off. So parliamentary colleagues, I would invite you to really read through when you have the time or make the time. All of us are traveling back by plane except, of course, our Trinidadian colleagues. So you can occupy that flight time if you don't have work like me to do, to read through the booklet, as I said, well presented and well done. And once again, I want to take the time to place on record my gratitude to ParlAmericas and for the very important work they are doing in this journey of strengthening parliamentary democracy throughout our regions. And I thank you very much.
Thank you, President Humphreys. That was very helpful because we do hope that you find this resource very, very useful. So please do use it. And if you need more copies, it is online and we can arrange to help you get more copies. I would now like to invite our colleague from Cuba, Irez Betancourt, who's going to present to us some outcomes from a recent activity we had in Panama on disaster risk reduction.
Buenos días a todos, a todas y a todos. En primer lugar, agradecer una vez más a nombre propio y de mis compañeros la oportunidad que nos han dado de participar en este 10º encuentro de Red Parlamentaria para la Igualdad de Género en ParlAmericas, Acción Climática con Perspectiva de Género. En lo particular, y les voy a solicitar que me permitan
majority of parliamentarians in Cuba. 53% of the parliamentarians are now women. This is also important for us because in the Council of State, which is the entity that executes the actions of the Assembly intersessionally, out of 61 members, 48% are women, and out of the 5 vice presidents, 3 are women. This for us has been very significant. We're very proud of this achievement, and it means that we may be able to advance much more quickly in terms of gender equality, transformative changes within the Parliament. And I think that sometimes simply achieving parity or having a good number of women in the Parliament, that does not automatically mean that we will achieve gender equality. There is still a lot of work to do. I'm also very happy to have the opportunity to present this video, which is a very short video, very interesting one nonetheless. It deals with disaster risk reductions and the outcome of a meeting that took place in Panama in February of this year. For all of us in Cuba, this is significant because we have been developing some lessons on disaster risk reduction. And as you know, we're an island and we are subject to a lot of natural disasters, including hurricanes and earthquakes. And so since 1991, we've been developing scientific studies and bringing together a lot of ancestral knowledge from the populations that live in the coastal regions. And that led to the approval in 2007 of the state plan on climate change. And there are some very interesting ideas in there with regard to coastal protection, especially of those sites that are important for our tourism industry. And there are specific actions for the short term for us, that's 2020, medium term, which is 2030, and long term, which is 2050, and for the very long term, which is 2100. And this is a very ambitious plan, but we hope that we will be able to work on it and achieve it little by little, even though our financial situation in the country is difficult. And I definitely could not leave this meeting without letting you know about these developments. I also wanted to remind you that we are at the disposal of our brothers and sisters in the Americas. We're very happy to share all of our experiences on disaster risk reduction. And now, moving on to what I've been asked to do here today, which is a presentation of the video. As you know, ParlAmericas support parliamentary action on climate change through innovation, dialogue, and partnership programs for parliamentarians of the Americas and the Caribbean. And through the Parliamentary Climate Change Network, we seek to consolidate commitments at the highest level to mitigation and adaptation to climate change. ParlAmericas has been working in cooperation with UN entities and specifically with the UNISDR, in the development of a parliamentary protocol on climate change and disaster risk reduction in the Caribbean. This protocol will be a guide for national parliamentarians of the hemisphere to align their national legislation on disaster risk reduction with the Sendai framework and to promote an integrated framework that articulates disaster risk reduction, climate change adaptation, and sustainable development. The Parliamentary Network on Climate Change, in cooperation with UNSDR, organized a dialogue on disaster risk reduction in Panama in February of this year, as I mentioned, as part of the activities that have been scheduled to develop this protocol. And this meeting brought together legislators from the entire hemisphere, as well as civil society representatives and representatives from international organizations. Perhaps you will see yourselves in the video that we'll see shortly. During this activity, there were working group sessions to expand knowledge on these issues and to identify the differentiated impact that natural disasters can have from a gender perspective. And this is the issues that we've been working on since we've been here. There was also a field visit with the support of the Civil Protection System of Panama, which gave the parliamentarians the opportunity to observe the various dimensions of climate risk within an urban coastal community, as you will see in the video that we will show shortly. And we hope you'll enjoy it. Thank you very much.
Por ejemplo, entre otras variables, ya está presente entre nosotros. Hoy tenemos un mundo con más riesgo y con más gente viviendo en condiciones de riesgo.
As parliamentarians, we have a role in bringing awareness to our communities of the effects of climate change. Once we're talking climate change, we're talking disaster risk reduction. And I think all our citizens need to understand that there will always be the threat of disasters. Some are man-made, some are natural. And therefore, we have to understand the risk and recognize that there are steps that we can take to reduce the impacts of the threat.
In the working sessions, the delegates expanded their knowledge of the differentiated social impacts of natural disasters and climate change. In collaboration with UN Women and other regional partners, they examined policy frameworks and disaster planning from a gender perspective, with an understanding that empowering women and integrating their experience and expertise in disaster risk reduction will strengthen desired outcomes.
El cambio climático afecta a todos, pero sobre todo afecta a los más vulnerables, o mejor dicho, a los más vulnerables que no tienen la capacidad de respuesta para recomponerse luego de vivir en un suceso producto del cambio climático.
It's important to take recognition of climate change in that all development is intended for the improvement of the lives of the citizens of the particular community or country. And climate change has the effect to erode and annihilate a lot of the development, and therefore it means that budgets, which are always limited, are really being wasted if climate change is not factoring into conditions.
importante tener 4 prioridades, que son las prioridades del marco de Senda, y es conocimiento del riesgo, la gobernanza, la inversión y prepararse para la respuesta. El empoderamiento es la base principal de una buena preparación y de una buena respuesta.
When we look at disaster risk reduction, one has to look at it from short-term goals that need to be achieved, medium-term goals, and also long-term goals. If we are to leave a legacy behind, it would have to be one that suggests that we are doing the right things at this point in time so as to mitigate against any future difficulties that future generations will have.
Los parlamentarios en este sentido tienen, por supuesto, mucho que hacer, no solo en la construcción de legislación y de preparación institucional para este riesgo, sino que además tenemos un rol, como yo lo decía, político, es decir, el parlamentario es el que representa a las comunidades, representa a los distintos distritos de un país y es allí donde debe llevar el mensaje y además representa a la política en el mejor sentido de la palabra.
Me parece que el rol de los parlamentarios es fundamental. Fundamental en el poder avanzar en lo que es la implementación de los compromisos internacionales que los países han asumido a nivel nacional y también promover las acciones a nivel local, que es donde más directamente se resienten los impactos del cambio climático y los efectos de los desastres naturales traducidos en pérdidas materiales y humanas.
Here for the last 2 days has helped me to understand how important legislation and regulation is in helping to minimize the damages that we are seeing in our world today. So I thank you to ParlAmericas and I thank you to the United Nations for putting this conference on. More dialogue, more awareness helps us only get better at what we're doing. Thank you.
ParlAmericas, through its climate change program, delivers innovative programming designed for parliamentarians with the aim of fostering comprehensive and informed legislative action that contributes to sustainable development and climate resilience across the Americas and the Caribbean. The Dialogue on Disaster Risk Reduction and Climate Change Adaptation demonstrates a collaboration model to work with parliamentarians and the United Nations in developing new tools and knowledge resources that allow them to accelerate inclusive climate action and support the objectives of the Sendai Framework for Disaster Risk Reduction, the Paris Agreement, and the Sustainable Development Goals.
Wonderful. So there you go. We are hopeful our protocols, that just gives you a taste of the kind of work we're trying to do to develop some tools and the kind of work we're trying to do so next time when we're sending out invitations to come on our next climate change activity that some of you may wish to participate in that with us. The protocols will be launched upcoming in, I learned this problem yesterday, upcoming in Cartagena. And so we look forward to sharing those protocols with you, and we hope you find them very useful in your work in your parliaments. And the other trick there is that we were hoping everybody would arrive in time to start the session if I played a video, and they have. So we're going to move into our session now. I'd like to invite, well, it was a better way than just waiting. We got a video. I would like to invite my moderator and my panelists to please come up here and join me so we can move into the working part of our session here this morning. Gender, health, and climate change, promoting responsive and sustainable planning. So I do need our colleague from Trinidad and Tobago, Member of Parliament, Olivierre, Parliamentary Secretary in the Ministry of Energy and Energy Industries, will be moderating our session today. If you could please join me here. And then my panelists, I do have joining us from the Directorate of Gender Affairs in Antigua and Barbuda, Ms. Jacobs. Perfect. Please come join us up here. And I'm looking from my colleague from the UNFPA, the Caribbean Subregional, Aurora, Noguera-Ramkissoon. Please join us up here. And Ana Carolina Ogando from WIEGO, La Brasileira. Please come join us. And then my colleague from PAHO, Catharina Cuellar. Perfect. Thank you. All right. So now I'm going to hand it over to the very capable hands of our moderator. Did you want to stay in the seat or did you want to use the... I think he's going to give you a microphone. Perfect. I hand it to you.
Right. So good morning all. Members of Parliament of the various participating countries, members of ParlAmericas, members of the Diplomatic Corps, members of our NGOs and partner organizations, ladies and gentlemen. So welcome to this morning's session on gender, health, and climate change, promoting responsive and sustainable planning. There is no longer any doubt that Earth's climate is changing rapidly, mainly due to human activities. Climate change affects every aspect of society, from the health of the global economy to the health of our children. It impacts on the spread of infectious diseases. It impacts on the quality and availability of water in our wells and in our taps. It impacts on mortality rates resulting from extreme weather events. It causes disruption of human security due to forced migration. It causes changes in agricultural production and impacts the food on our table. It impacts on income generation potential. It impacts on mental health and the human psyche. In short, climate is at the core of all the major challenges we face today. From the presentations we heard yesterday, there is clear evidence that many of the impacts of climate change, including the health risks, show important gender differences. So in this session, we apply a gender lens to analyze the impacts of climate change on the health sector. The objectives of the session are: 1, to examine the ways in which climate change can affect human health and the gender and intersectional differences that can be seen in these impacts, as well as the tools needed to help determine the population's need to facilitate appropriate planning. Objective number 2, to consider measures that will help strengthen the ability of national healthcare systems to adapt to climate change in a way that guarantees equitable access to essential supplies and services in the face of differential and changing needs across the population. And objective number 3, to outline key actions that we as parliamentarians can take to strengthen the responsiveness and national healthcare systems and the emergency response procedures to gender and climate change. We have an excellent panel before us, and the format is that we'll allow each member to make a 10 to 15-minute presentation. We won't have any questions after each presentation, so if there are any questions that come to mind, you jot them down, and time provided, we will take a question and answer session at the end. So I will invite our first presenter, Ms. Farmala Jacobs, who will present on the response efforts by the Department of Gender Affairs in Antigua and Barbuda in the aftermath of the recent hurricanes. She will expound on the importance of developing plans that include addressing issues of gender-based violence as a public health issue in post-disaster setting. Ms. Jacobs is the Acting Executive Director for the Directorate of Gender Affairs in Antigua and Barbuda. She has over 10 years of experience in youth and gender developmental work. Her youthful appearance doesn't indicate that at all. Her recent accomplishments include establishment of a national electronic database to track cases of gender-based violence and establishment of the region's first 24-hour one-stop shop, providing support and referrals for survivors of gender-based and sexual violence. She currently serves as a member of the OAS Technical Committee of Experts on implementation of the Inter-American Convention on the Prevention, Punishment, and Eradication of Violence Against Women. Ms. Jacobs is a holder of a bachelor's degree in labor and employment relations and a master's in public policy, as well as a professional certificate in gender and development studies. So let us welcome Ms. Jacobs with a resounding round of applause.
protocols previously established. First of all, I would like to begin by thanking the ParlAmericas Association for inviting the Directorate of Gender Affairs to be here today and to make this presentation. The Directorate of Gender Affairs is the national gender machinery that is responsible for promoting gender equality and women's empowerment in Antigua and Barbuda. The Directorate also operates a fully resourced 24-hour one-stop center in response to gender-based and sexual violence. On September the 6th, 2017, Hurricane Irma made landfall in Barbuda as a Category 5 storm with excess winds and intense rainfall. The island of Barbuda was evacuated and the affected population was brought to Antigua and placed into shelters. Overall, there was a lack of coordination between state actors, and that was primarily because of the absence of specific sector disaster prevention and response plans to address the issues and the needs of the population, particularly around issues of gender-based and sexual violence. The situation was such that all Barbudans who were brought to Antigua on the evacuation order enforced by the government had to be placed into shelters. There were various tables set up at the receiving and distributing center, and citizens were encouraged to provide supplies that the Barbudans needed. And they were also in a position to register their various needs. However, while the support for the items from the public have been overwhelmingly positive, there were initial items that were needed that were either missing or persons were not comfortable asking for, such as sanitary napkins, men's brief and boxers, and underwear. Over 1,000 dignity kits were provided through UN Women Multi-Country Office and UNFPA, and they were distributed to women, men, boys, and girls within all shelters in Antigua and Barbuda, and to those who were staying in private homes. The dignity kits included items such as sanitary napkins, underwear, deodorant, toothbrush, toothpaste, comb, condoms, soap, lotion, shampoo, conditioner, rag, elderly pampers, and toilet paper. The dignity kit items were also shipped and distributed within Dominica after Hurricane Maria. Because of the demand, it was necessary for us to secure the items and compile the kits with the necessary goods for each Barbudan who were affected. The day before Hurricane Maria was expected, my team and I, with the assistance of UN Women, secured the items, and with assistance from community members and civil organizations, we were able to pack over 300 kits the evening before Hurricane Maria was about to start, and after we packaged the kits, we distributed them across the shelters in Antigua and Barbuda. However, Hurricane Maria did not affect us, but it impacted Dominica. And so we quickly mobilized with UN Women and UNFPA and the World Food Program, and we shipped pre-packed dignity kits to the Bureau of Gender Affairs in Dominica, where they distributed them. Also, we conducted some shelter assessments. The Directorate of Gender Affairs, in collaboration with UN Women, UNICEF, UNFPA, and IOM, conducted assessments of the shelters where Barbudans were placed, and we provided recommendations for improved well-being and safety. The shelter assessments followed the guidelines for integrating gender-based violence prevention in humanitarian action. The Directorate of Gender Affairs also led the development of shelter guidelines for the prevention of gender-based violence within shelter settings in Antigua and Barbuda. Also, prior to Hurricane Irma, shelter managers were trained, but not specifically on preventing and responding to gender-based and sexual violence within shelter settings. So we thought that this was necessary. The Directorate of Gender Affairs, in collaboration with UNFPA, facilitated a shelter management training on the guidelines to integrate gender-based violence prevention in shelter settings. The shelter training was facilitated by both the Directorate and UNFPA. There were over 20 beneficiaries from the training, which include shelter managers who are also from Barbuda. The shelter managers training framework and outline will be used as part of the standard training that will be provided by the National Office for Disaster Services for upcoming training of shelter managers. Given that the health sector are specialized actors who are sometimes first responders, we also trained doctors and nurses at the Mount St. John's Medical Center on gender-based violence screening and response, ensuring that they are equipped with referral services and entry points. So the Directorate of Gender Affairs, along with UNFPA, led a training exercise for healthcare providers at the Mount St. John's Medical Center. The training provided the health sector in Antigua and Barbuda with basic sensitization on gender-based violence prevention and response, screening during emergency settings to facilitate the clinical management of rape, providing confidential care for survivors of sexual violence according to the IASC GBV guidelines. Within the shelter, the Honorable Samantha Marshall, Minister responsible for Gender Affairs, commissioned the establishment of a child-friendly space for the Barbudans. A mural was painted by young Barbudans and art students, and the Directorate of Gender Affairs facilitated this process. The space is an environment for Barbudan children to enjoy and therapeutic surroundings while they play and communicate with each other within the shelters. During the humanitarian response, we also received assistance from UN Women Multi-Country Office to provide strengthened coordination among the various sectors, particularly within the Ministry of Social Transformation and the Ministry of Health. So the UN Women Multi-Country Office assisted us in coordinating meetings between each sectors to ensure that we have a strengthened response when we were putting things in place to respond to any incidents of gender-based and sexual violence. Recognizing to the importance of awareness and ensuring that the population have the necessary information on where to access services and the types of services that were available, a campaign was launched to promote existing services. And this campaign was launched, again, in collaboration with UN Women and UNFPA. Over 5,000 bumper stickers and informational brochures on police services, medical services, the referral pathway, counseling services, and information on gender-based violence in emergencies were distributed across the population, both in Antigua and in Barbuda. We know that while there might not be any reports of gender-based violence during or after a disaster, we assume that it is happening. It is very important that there are working coordinated systems before a disaster. The stronger the foundation, the stronger the response. In June of 2016, Antigua and Barbuda launched its one-stop location for gender-based violence. The gender-based violence services were expanded to ensure that the Barbudan community had 24 access to the services. The Support and Referral Center provides specialized services such as intake and case management, medical, psychosocial, legal, and child services, along with shower facilities, all from one location. Although the center did not receive any reports from the Barbudan community on gender-based violence, we continue to provide ongoing quality care and treatment to any survivor and increase awareness on the services that are available to them. We also worked on establishing a referral pathway to ensure that we mapped out the various entry points where report can be made, and also to explain to the population the steps that will be taken from each entry point once reports of gender-based or sexual violence are made, either to the police, to the Directorate of Gender Affairs, to any of the health sector clinics or the general hospital, through 911 or through any of our civil society organizations. And so we have established a very strong coordination through a referral pathway that we continue to work on and improve to ensure that persons understand the full process for making reports. We also had the opportunity, with the support of UN Women, to go to Dominica to also support the response there. And so the Directorate of Gender Affairs provided South-South collaboration by supporting the Bureau of Gender Affairs in Dominica on collecting information to go towards the analysis for the post-disaster needs assessment. And so we provided assistance in conducting focus groups and interviews within the various communities in Dominica to gather information on the response to the Hurricane Maria. We continue to provide ongoing support. Currently, we are rolling out a major program that is geared towards, again, increased awareness and knowledge on preventing and responding to gender-based violence. We're working with community groups involving youth and children, men's group, faith-based organizations, and also the media to ensure that persons are equipped with the knowledge and the information, again, on how to prevent gender-based sexual violence and where to go if it does occur. During our coordination and response, we've learned a number of valuable lessons, and these lessons include that there was a lack of capacity and resources in some instances, which acted as a constraint to implement programs, and due to limited coordination, the relevant agencies that were supposed to be providing services were limited in their response. We also learned that socioeconomic cultural norms around gender equality and gender-based violence and the lack of understanding on the importance of gender integration and mainstreaming also makes the response challenging. As we heard yesterday, there are climate change actors and disaster first responders who either do not understand gender or who think that it is not important. There's also a lack of national mechanism to include the participation of women and girls and the ability to respond to the needs of vulnerable groups. This is very important because vulnerable groups such as persons with disabilities are still feeling left out of the conversation, and their needs will not be met if they are not included in shaping their own realities. We also saw that the lack of sex disaggregated data to inform appropriate program responses and the lack of prevalence data on gender-based violence also makes it difficult to make a case for improved and increased resources to address this issue. We also learned that there is a lack of gender considerations in early warning systems, and also that gender-based violence should really be framed as a public health issue within our populations. So now I'm just going to turn to some points that we should consider when we are promoting gender-responsive disaster risk reduction planning. We should adopt and implement institutional policies and standards to strengthen gender equality nationally, to prevent and respond to gender-based violence as a public health issue, and enhance state accountability. All levels within the humanitarian architecture should promote effective and accountable interagency, sectorial gender-based violence leadership and coordination. Needs assessments, analysis, and planning processes need to support effective and accountable integration of gender-based violence and response and gender equality into humanitarian response efforts. There is need also for funding for dedicated gender-based violence prevention and response for each phase of an emergency, from the preparedness and crisis onwards throughout the recovery and the development. There is also need for specialized gender-based violence prevention and response services to be implemented at each phase of an emergency. There is also need for ongoing monitoring and evaluation on the quality of gender-based violence response services across sectors. We cannot continue to believe that because a service exists, it is working or that it is impactful. We need to continue to evaluate and improve our interventions so that they are indeed meeting the needs of those that we seek to serve. We need to establish strong referral pathways and referral networks, and we need to ensure that the humanitarian actors acknowledge the standards that are set nationally so as to ensure that they too have the skills necessary to prevent and respond to gender-based violence, and we do not have any case of exploitation or further disasters. As we move towards a strengthened and coordinated approach, we also need to recognize that risk and vulnerability have a fundamental social dimension, and this should guide all the work related to gender risk reduction planning. We also must promote a genuine, inclusive stakeholder involvement and consultation, and strengthen the capacity of the disaster management staff, policymakers, and first responders and specialized actors to promote gender equality through ongoing training. We also need to document the different roles that women and men play in the various sectors, such as in tourism, agriculture, fisheries, and construction. It is very important for us to continue to document this so that we can have the baseline data when it's time for us to conduct post-disaster needs assessment. We have a clear understanding of where we were before when it comes to gender equality within our various nations. We also need to ensure that we enforce effective laws and ensure that the law enforcement agencies are equipped to be able to prevent gender-based violence and also to respond to any incidents pre, during, or post a national disaster. And finally, I would just highlight some roles that parliamentarians could promote. Parliamentarians should include gender equality among the national guiding principles of any disaster risk reduction planning. Again, include women and men, particularly from marginalized socioeconomic groups, in decision-making processes and in the implementation, monitoring, and evaluation phases. Make a commitment to reduce the gender gap between men and women nationally, even outside of a disaster. Involve women in the disaster risk reduction committees, and also ensure that there are various training to build their capacities to respond. Ensure that early warning systems meet the needs of both men and women and that they are involved. Increase women's participation generally and overall, nationally, in all sectors and spheres in government and civil society and private sector. Promote and resource gender focal points to ensure gender issues are integrated, and also commit to strengthening national gender machineries. Develop gender-based violence cluster groups with key agencies to link basic services with other key agencies such as education, health, and legal sectors. Equip the national actors with the necessary resources that are needed. Encourage and enforce gender budgeting, and I know that a training was done on this a day ago. Encourage the development of case studies to document who benefits from the interventions, and this is something that we need to do more within our regions, because we need to ensure that we are documenting lessons learned and best practices so that we can share with each other. Parliamentarians should also promote the use of an integrated system to track and monitor gender-based violence. This is very important. Also call for the inclusion of gender-based violence in all crime prevention programs and strategies. Promote gender-based violence as a public health issue. In some jurisdictions, gender-based violence is seen as only the work of national gender machineries, and this is definitely not a good approach and will not meet the needs of our population. Also create an enabling environment for gender-responsive disaster risk reduction planning, implementation, monitoring, and evaluation. Make linkages between climate disaster, economic issues, violence issues, poverty reduction issues, because too often we have national plans and policies operating and being implemented in silos, and we're not making the clear linkages between all of these issues. And finally, it is very important for us to ensure that we have national strategic action plans in place in the first instance to prevent and respond to gender-based violence. So even throughout a disaster, we already have a strategy and an approach that we can use nationally to ensure that we're equipped to address this issue. Thank you very much.
Thank you very much, Farmala, for that very detailed and comprehensive model.
Sorry, can you just let somebody know they lost their phone? Somebody lost it.
Oh, we found a phone if anyone is missing an iPhone.
Okay, thank you.
Yes, thanks.
I just don't want anybody to feel stressed out about the lack of technology.
Yes, I'd really like to thank the example from Antigua and Barbuda. That was a very detailed and comprehensive model for how you can prepare to respond to a disaster. And I think that we would have all learned a great deal from that presentation. And it's an excellent model that we can all adopt. Because many of the stories that you would have indicated, these are the stories that do not come out in the public domain during a disaster. But they are facts that would have to be considered. And unless you have experienced it, you really may overlook the need to consider gender-based sexual violence as being part of what's required in considering developing a response plan to disasters. So I'm sure that many persons will have lots of questions for Farmala, but if we don't get time at the end of the session, we can always speak to her one-on-one afterwards. So let's give her a round of applause again for that very comprehensive presentation. Thank you. I'd like to also acknowledge in our present the Senator, the Honorable Christine Kangaloo, President of our Senate, who joined us during Ms. Jacobs' presentation. Thank you for joining us again. Next, we have Ms. Aurora Noguera-Ramkissoon, who will enlighten us on the work done in the region by the UNFPA in responding to the humanitarian needs related to climate impacts and natural disasters. So while she makes her way to the podium, I'll just give you a brief bio. Ms. Noguera-Ramkissoon is the liaison officer for the UNFPA's Subregional Office for the Caribbean at the Trinidad and Tobago office, where she has worked since 2012. She has over 25 years of experience working in the Caribbean and in the US in social and economic development, with a focus on research, capacity development, strategic planning, and program management. She has worked extensively in the area of sexual and reproductive health, including issues of gender-based violence, sexually transmitted infections, including HIV, agricultural development, and statistics. She's also trained in the delivery of the Minimum Initial Service Package, a series of crucial actions to respond to reproductive health needs at the onset of a humanitarian crisis. Ms. Noguera-Ramkissoon holds a bachelor's degree in social science and a master's in public administration. Let us welcome Ms. Ramkissoon.
Good morning, and thank you, Chair, distinguished parliamentarians from Latin America and the Caribbean and Canada. I'd like to acknowledge the protocols that have already been established, and to also thank ParlAmericas for putting this session together, which I think is quite informative and timely as we approach the hurricane season. So I will speak to you a little bit about UNFPA's work in addressing disasters. I won't go through everything that might be in my slides in order to not be repetitive to some of the issues that have already been raised, right? So as we've been discussing, humanitarian crises are not gender neutral. They impact different people differently. During a humanitarian crisis, low-income individuals and families living in precarious situations usually suffer the worst damage and find it very difficult to overcome these adverse circumstances on their own. Therefore, their protection is a matter of priority, and we encourage parliamentarians to take a human rights-based approach, looking at issues of reproductive rights and universal access, which is part of our Sustainable Development Goal 3 that many countries have agreed to. So this human rights-based approach is an essential framework for our interagency humanitarian response actions, as it emphasizes the basic needs of individuals, particularly those in situations of increased vulnerability. Now, according to UN reports, 60% of maternal deaths occur during humanitarian emergencies, and all forms of violence against women and girls peak during disasters and conflicts. 60% of preventable maternal deaths and 53% of under 5 deaths take place in countries affected by or prone to conflict, forced displacement, and natural disasters. In fact, worldwide, women and children are up to 14 times more likely than men to die in a disaster. Hence the importance of discussing the gender dynamics. Fortunately, the vast majority of maternal and newborn deaths can be prevented with proven interventions to ensure that every pregnancy is wanted and every birth is safe. Now, some of the causes of the gender-based violence is due to some of the practical considerations, the breakdown of the community and the family structures, the collapse of the institutional social protection systems, including the referral pathway that Ms. Jacobs spoke of in her previous presentation. In addition, you know, we heard about the experience of Haiti with the tent cities, the overcrowding, the insufficient doors, partitions in sleeping areas, inadequate locks, and lack of privacy for dressing and bathing in communal shelters. These all increase the risk for gender-based violence. The Latin American and Caribbean regions continues to face diverse emergencies, whether it's the natural disasters that we've been speaking about, armed conflicts, what they call unconventional violence or the chronic violence, epidemics such as Zika and malaria, and we're also witnessing the migration of many Venezuelans to our territories. So this makes our region highly vulnerable. The reality negatively affects the full exercise of the rights of girls, women, adolescents, and other vulnerable groups, impacting the quality of life. Between 2003 and 2017, the natural disasters in the Americas and the Caribbean left an estimated 300,000 people dead and affected more than 70 million people. These disasters annually represent a significant percentage of the gross domestic product of the affected countries and a high increase in the percentage of social expenditures. So let me just speak briefly about UNFPA's mandate in this area. UNFPA, the United Nations Population Fund, has committed to jointly intensify support to ensure universal access to sexual and reproductive health and rights in crisis settings. The 1994 International Conference on Population and Development, the Program of Action, ICPD, it placed women's rights, empowerment, and health at the center of development efforts. It also affirmed the rights to sexual and reproductive health and the right to live free of sexual violence and other forms of gender-based violence. And it applies to all people at all times, including populations affected by emergencies. The Sendai Framework on Disaster Risk Reduction, which most of the countries have agreed to, calls for building resilience. What mechanisms do we have in place to ensure that this resilience is built to protect our vulnerable groups before disaster? For women in particular, part of being safe during disasters means ensuring safe birth, safety from unintended pregnancy, and safety from violence. UNFPA, our mandate, seeks to ensure, one, the provision of emergency SRH services in humanitarian context as an essential component of life-saving activities. Gender equality, gender-based violence prevention, mitigation, and response, the improvement of data availability and the analysis around population dynamics. You know, based on data, who do you focus on? I'd like to just share with you some of the tools that we use. One of the main ways we are supporting the emergency response is through the delivery of what we call the MIS, the Minimal Initial Service Package for Reproductive Health. And this is done within 48 hours of an emergency. The goal of the MIS is to reduce mortality, morbidity, disability, and gender-based violence, particularly among women and girls in populations affected by the crisis. But it also includes internally displaced populations and refugees. The activities of the MIS are particularly designed, one, I'll just say it briefly, to prevent and manage the consequences of sexual violence. 2, to reduce HIV transmission. 3, to prevent excess maternal morbidity and mortality. And 4, to plan for the return or the establishment of comprehensive sexual reproductive health services. And these are integral to be part of the primary health services. UNFPA continues to train our stakeholders in this MISS, establish cluster focal points, and teams to address both gender-based violence and sexual and reproductive health, and to ensure that SRH is included in our national disaster emergency response plans. So I'm going to go a little bit deeper into some of the data that is needed, right? On Tuesday, we heard from UN Women about some of the data that is needed to support both the response and the recovery efforts and the post-disaster needs assessment, otherwise known as PDNA. In general, what is needed is up at the lowest subnational level, the number of people by age group and sex, and we need to utilize population projections because we have the census, which is done at every 10 years, but we need to analyze what has been the shift from a year-to-year basis. Now, UNFPA assists countries in generating and using this socio-demographic data for the designs of policies and programs to improve and protect human lives in the 4 phases of what we call the humanitarian crisis: preparedness, acute, chronic, post-crisis, and recovery phase. I'm just going to go briefly through each of these phases for you and the data requirements that are needed. So the preparedness phase, this is the time preceding the crisis. This is now for many of us when the disaster has not yet occurred. It is the most important preventative opportunity for the country to be able to carefully identify and analyze areas prone to national hazards and the characteristics of the populations who are exposed to them. Now, to prepare for this stage, we strongly suggest the collection of baseline data, such as the potential hazards, whereby you can use this information to model the potential risk scenarios with stakeholders, socio-demographic information, and the population projections. The census data, which I mentioned before, household surveys, administrative records, which tend to be more frequent. These are all sources of data which can be used to model your scenarios. With this data, an organized information system can be developed, which is generally called the early warning system. And it could be implemented along with contingency plans. This would help to enable comprehensive national coordination by the community and the various humanitarian actors in the event of an emergency. We have an example of St. Lucia where we provided some support actually in geographically mapping some of the vulnerable populations, including the elderly, the disabled, pregnant women, so that any point in time when a disaster occurs, you could look geographically of where these vulnerable populations are located. The acute phase is a phase where we actually activate the contingency plan and the first emergency interventions are conducted. It corresponds to the moment that a crisis situation unleashes and the population is not equipped to meet its own basic needs and requires the most assistance. At this stage, we recommend the use of MIRA, which is a multi-sector assessment conducted by key stakeholders during the first 2 weeks following a sudden disasters. It's part of the tools of the PDNA. Its objective is to provide basic information on the needs of the affected populations and the priorities for international aid. MIRA allows the stakeholders to establish a common understanding of the situation and its probable evolution from the outset, and it allows them to agree upon immediate strategies. The third phase, what we call the chronic phase, is the phase where data is collected on the essential indicators established during the preparation phase. This, again, is part of the PDRA, and it helps to enable an assessment of the size and geographic distribution of the population and displaced households. And we suggest that the following indicators be considered as priority: the estimated number of households and displaced people affected by the crisis, estimated number of households and people that remain in the affected area, the causes and direction of population displacements, and the capacities of the health sector in both the areas where the displaced population is housed, as well as the affected areas. I realize it's a bit of detail, but it's to give you a little snapshot of some of the data requirements. Now, finally, there's the post-crisis recovery phase, which is the period where we return to normality. This is the time for the resettlement of the population, reconstruction, rehabilitation, the psycho-affective recovery of the people affected by the crisis, and the transition period towards recovery. Key data to be obtained is the changes. You can now compare from your baseline in each phase, the changes in the number and distribution of the housing and households, the changes in size and distribution of the population, the changes in age and sex structure, and the location of basic social infrastructure. The data collected during these phases help to build back better and assess the depth of the impact of the population. There are a few examples. We heard a very good example preceding my presentation from Antigua and Barbuda, so I won't go into depth about the work we have been supporting in the Caribbean. But in general, we know we recently experienced the earthquake in Mexico, in addition to Maria and Ivan that destroyed many or damaged many of our Caribbean countries. There was also Tropical Storm Nate in Costa Rica, Nicaragua, and Guatemala. In some of these cases, they were extreme emergencies, and the countries were not necessarily prepared or organized to deal with them, as we heard from the Antigua-Barbuda situation. During last year, for the Caribbean in particular, UNFPA mobilized approximately $1.5 million to respond to the humanitarian needs of 300,000 affected women, girls, and adolescents. And I'll just summarize some of the areas we provided support, both in the Caribbean and Latin America. It included strengthening the humanitarian coordination and response building, including supporting MISP implementation, rebuilding and enhancing social protection systems for gender-based violence services and capacity building of partners, preventing maternal morbidity and mortality, particularly related to obstetric complications, and we would have heard by the provision of both the dignity kits and the reproductive health kits. Now, our support to these actions help to ensure the rights of persons impacted by these emergencies are protected and decreases the risk of maternal and infant mortality, which many of our countries are still dealing with, as well as STI and HIV infection, unwanted pregnancy, sexual violence and exploitation, and other reproductive health-related conditions. In conclusion, I'd just like to highlight some recommendations that we have for you parliamentarians as we go forward in addressing our humanitarian actions. First, we suggest that a multi-sectoral, well-coordinated response is required, pulling in all partners, government, civil society, international agencies such as ourselves, the UN, SEDIMA. Two, we need to ensure that sexual and reproductive health is integrally a part of our natural disaster plans, with focal points established in key areas and early warning systems and contingency plans established. We need to scale up the implementation of our 2030 agenda, because by scaling it up, we're ensuring that we're not leaving anyone behind, and it particularly applies when faced with an emergency, particularly for those vulnerable groups. We need to ensure that psychological services for gender-based violence survivors and for the prevention of GBV are in place, as well as improve capacity of our healthcare systems and our healthcare workers to address these issues. We must ensure that our first responders who have training, they're equipped with the tools to respond. And in talking about gender budgeting and budgeting for finance, we ask you to finance humanitarian action, including access to sexual and reproductive health, geographic mapping of these vulnerable populations, and other populations with special needs. So in the countdown to 2030, to further the agenda on humanity, we call on you to accelerate these efforts in order for us to achieve universal access to sexual and reproductive health and to ensure humanitarian action. Thank you for allowing me to speak to you this morning.
Thank you very much, Aurora, for that global perspective on the humanitarian impact of disasters and enlighten us on the ways in which the UNFPA have been lending support. And again, we hear the recurring theme of the importance of having the data in a sex-disaggregated manner to enable effective planning to respond to disasters. So next presentation would be by Ms. Anna Carolina Ogando, who will introduce us to WIEGO, Women in Informal Employment, Globalizing and Organizing, and the work that they do in Latin America with respect to the social protection and access to healthcare for informal workers and citizens. This is often a group that is mainly ignored by the mainstream, so it's good that we have an NGO that is focusing their efforts along this line. Ms. Anna Carolina Ogando is a research associate for WIEGO's Urban Policies Program, where she provides research support to programs on qualitative and participatory methodologies, gender and waste and urban-related issues. Based in Belo Horizonte, Brazil, she has collaborated on several WIEGO projects, including the Gender and Waste Project, the Child Care Initiative, and health risk mapping with waste pickers. She was the senior qualitative researcher for the Informal Economy Monitoring Study Team in Brazil. She previously taught at the Federal University of Minas Gerais and was an affiliated researcher at the Women's Studies Research Center. She holds a PhD in political science from the Federal University of Minas Gerais. Minas Gerais. Her PhD specializing in gender, feminist theory, and social movements. So let us welcome Ms. Dr. Anna Carolina Ogando.
Good morning, distinguished parliamentarians, participants, fellow panelists, and moderator. These past few days have been an important learning exchange for all of us, and I am truly grateful and honored that ParlAmericas has invited WIEGO to join these discussions. The question I want to pursue this morning with you can be phrased in the following terms. How can commitments to establishing gender-just and sustainable cities be one path for understanding the role, contributions, and challenges faced by informal workers, particularly given the risks associated with climate change? I hope to address this complex question by discussing WIEGO's work with informal workers, particularly waste pickers, and more specifically by drawing on insights from an exploratory, small-scale health risk mapping with waste pickers who work in sorting centers in Belo Horizonte, Brazil. My overall objective in this discussion is to show how waste pickers' contributions to the environment and to the economy can help us think through ways of inclusion in urban systems that mitigate risks, including health and others, but also value these individuals as workers and as citizens who have the right to decent work and a dignified life. WIEGO is a global research and advocacy network that focuses on securing livelihoods for the working poor, especially women in the informal economy. We have three missions: increasing workers' voice by strengthening organizations of the working poor, increasing workers' visibility through research and statistics, and third, increasing workers' validity by promoting the inclusion of these voices in policy-making processes. A key concern for WIEGO's social protection program is how informal workers who operate in streets, private homes, waste dumps have access to health services, especially since mainstream OHS does not cover these workplaces. In this sense, efforts should be made to think about universal health coverage from the perspective of informal workers by focusing on financing, the delivery of health services, and the importance of preventive health. Hence, improving incomes and overall working conditions for informal workers needs to be linked to struggles for better health. WIEGO has been working with informal waste recyclers for over 10 years now and works closely with waste pickers at local, national, and regional levels in Asia, Africa, and Latin America. Waste pickers are informal workers who collect, separate, transport, and package solid waste for reuse or recycling. One of the ways to increase waste pickers' visibility and validity has been to highlight their economic and environmental contributions through recycling. A 2013 ILO study pointed out that 20 million people earn their living from recycling waste in developing countries. In addition, it is known that recycling is one of the cheapest and fastest ways to reduce GHG emissions. A study by GIZ in 6 cities found that in 3 of them, waste pickers recovered about 20% of all materials that would otherwise enter the waste stream. As waste pickers seek to sustain their livelihoods through recycling, they are also at the heart of the fight against climate change by reducing the demand for natural resources and by reducing GHG emissions. Despite such contributions, there are clear risks faced by waste pickers given the health conditions of workplaces. It is known that different workplaces will present different levels of risks for waste pickers, as is the case of open dumps. In addition, the length of exposure to different hazards, the availability of interventions, access to information, access to assets, and identity markers such as gender, sexuality, age, race, and ethnicity are all factors that should be considered. Generally speaking, some of the socioeconomic, health, environmental, and gender-based risks faced by waste pickers to varying degrees include being at the bottom of the value chain, having less access to valuable materials, especially for women waste pickers in open dump scenarios, being exposed to various biological, chemical, safety, ergonomic, physical, and work organization hazards, facing harassment and violence from middlemen and authorities, facing discrimination from society and authorities, dealing with threats to livelihoods such as incineration technologies, experiencing gender-based violence both at home and at the workplace, dealing with child and family responsibilities, which leads us to the importance of thinking of child care facilities near workplaces for these workers, and living in vulnerable areas or informal settlements, often with poor housing conditions. In the specific case of Brazil, these workers are mostly Black, poor women who head their households. With these issues at hand, and given waste pickers' health concerns expressed in WIEGO's 10-city informal economy monitoring study, the Gender and Waste Project carried out in Minas Gerais, and in waste picker network meetings in Belo Horizonte, the Cuidar or Care Project emerged. The project was designed with input from waste picker leaders from the second-level network of cooperatives, Rede Sol. It is an exploratory health risk mapping in 5 of the 14 cooperatives that belong to Rede Sol, being that these 5 cooperatives have different layouts, infrastructure, and sorting processes, and the majority of the workers in 4 out of the 5 cooperatives are women. The general objectives of the project were to capture waste pickers' perceptions on health, health risks, workspace and infrastructure, quality of and access to public health services, their coping strategies, and inputs on how to improve work conditions. In addition to these objectives, the project also sought to answer 4 important questions. First, how do different workspaces affect levels of vulnerabilities and health risks? Second, how does an intersectional approach help us understand the complexities of workers' health? Third, how can we value the knowledge of waste pickers have regarding such risks in ways to promote better and more accurate information on their needs? Fourth, and lastly, how can this information sensitize stakeholders, policymakers, researchers, and other potential allies to listen to, support, and collaborate with informal workers to minimize health risks, including in moments of crises? Information was collected through a mixed methods approach, including participant observation, 5 participatory focus groups, 5 semi-structured interviews with leaders, and 48 surveys from September 2017 through January 2018. Popular education tools grounded on participatory action research principles were used in technical visits and group discussions to build rapport with waste pickers, and then were followed by more structured interventions. Some of the tools used to understand the impacts of infrastructure, ergonomic, and work organization hazards include the use of spatial maps in focus groups and body maps in surveys, flow diagrams to map workers' coping strategies, and an institutional matrix to understand when and how workers access public services were also used in focus groups. Findings from the project reveal a common concern, particularly among older men and women waste pickers with non-communicative diseases such as diabetes and hypertension. Other findings corroborate with studies that have shown how a lack of infrastructure and equipment, as well as improvised workspaces, increase ergonomic hazards. Exposure to sun, dust, and extreme temperatures are also considered problems that intensify workers' exhaustion. In terms of a closer gender lens, many women waste pickers also claimed it was difficult to deal with care and household responsibilities after a strenuous day. The sexual division of labor noted in some of the cooperatives, with sorting tasks designated primarily to women, also deserves attention regarding medium to long-term impacts on one's health. Lastly, men and women waste pickers express concern that socioeconomic stress greatly affects their emotional well-being, understood for them as a central component of living a healthy life. Nevertheless, the project also sought to capture workers' agency. In this sense, we found waste pickers' greater awareness for the need and use of protective equipment. Workers, and particularly women leaders, highlighted the importance of establishing healthy, decent, and safe environments as a means of improving workers' emotional well-being. And younger women waste pickers, who have witnessed the health problems faced by older women waste pickers, claim there is a need to focus more on preventive health and have more information on women's health issues. It's worth noting that some of the risks discussed here can be exacerbated by climate changes that have started to affect urban centers, such as increased intensity or frequency of storms, flooding, landslides, and heat waves. For waste pickers who already work in precarious infrastructures that lack ventilations, heat waves or intense rains will certainly present greater health risks, and even the spread of vector-borne diseases, which is a great concern in Brazil in the moment. Increased flooding and intense rains, as noted in some of the group conversations during the Cuellar project, have already affected waste pickers' warehouses, equipment, and ability to store materials. During these situations, many cooperatives lost materials, decreasing low earnings. The project made it clear how socioeconomic stress affects waste pickers' health. Given the lack of physical, human, and financial assets needed on a daily basis, dealing with climate change impacts becomes even more pressing. This leads us to consider how waste pickers perceive the quality and access to public health services. Findings from the project point to the fact that workers do make use of public community health centers, particularly in emergency cases related to work accidents. Waste pickers claim the quality of the service varies, but that in general, healthcare service providers should be more attentive and respectful. This would also particularly apply to greater attention to women's early and regular prenatal care needs. Choosing not to visit a health center after an accident or illness resulted from complaints about long waits, problems with referrals, and inconvenient opening and closing hours, which they fear would lead to a further loss in earnings. The Cuellar project has been an important space to access information from the ground on how policymakers and authorities can support and help mitigate the aforementioned risks, besides improving the overall standards of working conditions for waste pickers. I would like to highlight 4 recommendations here. Support from local and municipal authorities can be delivered through the collaboration on and/or offering of capacity building workshops related to workers' safety and health and to immunization campaigns. There are also successful cases of organizing large-scale health screenings with the support of volunteer doctors, nurses, technicians, along with worker organizations. In terms of climate change risks, a pro-poor and gender-sensitive approach can diminish the adverse impacts on those who already possess less access to resources and live and work in particularly marginal areas. It is a matter of working together to think about safe workspaces, urban infrastructure and mobility, and what skills and information are needed to avoid hazards in times of crises, economic or climate change related. In terms of contributions from civil society, authorities, researchers, academia, private sector, there is a need for awareness on the contributions and risks faced by waste pickers and other informal workers in urban settings. It's about building synergies among different actors with different expertise. In terms of greater sensitivity of health providers, public health workers, such as doctors and nurses and technicians, should receive specific training to deal with the needs of waste pickers and informal workers, and understand how these needs are built upon social, gender, and racial inequalities. And finally, in terms of the commitment and establishment of multi-stakeholder platforms, there is a need for input from workers to share their localized knowledge and needs. Knowledge articulated by marginalized actors is typically undervalued and ignored, meaning their voices are not heard on policy issues that directly affect them. As a recent ILO study notes, 2 billion people, more than 61% of the world's employed population, make their living in the informal economy. These voices need to be accounted for and included in planning processes. However, establishing such platforms should not be merely spaces for consultation, but rather open to effective and plural participation and representation. Given that women's voices are even less heard in such processes, participation and representation mechanisms that target gender disparity in decision-making arenas is a necessity. It is also worth thinking about the practical skills women need in order to enter these decision-making spaces. Climate change adaptation planning processes can thus be key moments to decentralize knowledge and shift power relations, contributing to the inclusion of the voices and needs of those who are often marginalized and most affected in times of crises. I would like to conclude with the words from Maria, a woman waste picker in Belo Horizonte, who has taught us about a more holistic understanding of health. It is a conception that leading a healthy life goes beyond a life without diseases and exposure to hazards. As she states, health is leading a life with dignity. It's not worrying about misery. It's about knowing I'll have enough to cover the very basics. Thank you.
Thank you very much, Dr. Ogando, for that. Certainly reminding us as parliamentarians that there are constituencies that may be underrepresented within our countries that we do need to pay particular attention to. Waste picking may be unique to some of the larger territories, but if we look around, there would be segments of informal workers that we have not paid any attention to, and we do need to ensure that their public health is being attended to. So again, thank you very much for that. So final presentation would be from Ms. Cathy Cuellar. Is that correct? Cathy Cuellar. I'm hoping that she will tie it all together by providing us some guidance on building health system resiliency and disaster preparedness and mitigation with responsiveness as a cross-cutting team. A native of Belize, Ms. How do you pronounce it?
Cuellar.
Ms. Cuellar is a public health specialist with over 20 years combined national and international experience working in public health in Latin America and the Caribbean. At the PAHO and WHO, she has worked in the areas of gender equality, violence against women, health promotion, and disaster preparedness and mitigation. Ms. Cuellar?
Thank you very much.
She is familiar with international, intersectional, and intercultural settings across the Americas. She's been the regional advisor for gender and health at PAHO in Washington, D.C. since 2011. So let us welcome her with a round of applause.
Thank you very much. First of all, greetings from the Pan American Health Organization to all distinguished delegates representing their countries, and certainly special thanks to ParlAmericas and of course our hosts today represented by Senator Kangaloo. For us at the Pan American Health Organization, it's a pleasure to be a part of this kind of debate. We believe it's an ongoing debate. It's a process. And we hope that after hearing all the wonderful experiences preceding my presentation, that I will concentrate on certain other aspects that perhaps may have escaped us. Also understanding that for PAHO, we embrace true public health from many angles, and so we are talking about the Department for Climate, the Department for Emergencies and Disasters, the Department for Gender, the Department for Healthy Cities and Healthy Communities, etc., etc. And so like parliamentarians, we're faced with the task of how do we bring it all together. So we're in the same boat, I'm merely trying to say. I had in mind to share a little video with you, but this morning we preempted by showing a very lovely video from the experience in Cuba, and instead of showing the video, we've decided it's on the site. It's in Spanish and English, unfortunately not in French, and so I encourage you to look at it. In effect, what it's talking about, however, I wish to draw your attention to three things, is primarily it is the countries themselves through a self-assessment telling the story of where they are today with regards to advancing mainstreaming gender equality in the health sector. 33 countries came together, and this is the report that they talk about in the little video. Two things stand out. One, the countries themselves acknowledge that the true measure to advance gender equality in the health sector, to have better responses on health, have to do with political will. You have heard the stories and you have seen the experiences in terms of maintaining and sustaining the political will to advance this agenda. It continues to be an issue. Second important point brought together by these countries, brought out from these countries, is the issue of monitoring and evaluation. But they have also introduced a new way of saying this, and accountability. Who accounts for and who accounts to with regards to this process. And the third one is one I have not heard explicitly in this particular gathering, is the issue of the expanding concepts for gender. Today's discussion on what the expanding concept of gender means and what the implications are as we live in a new world of leaving no one behind. So we will carry on without looking at the video, which was quite exciting, but you can look at it later. And try to, again, capture the true context of where we are today. And I will use, obviously, then, the first if you will, assessment of the SDGs, which was done very recently at the beginning of this year, where ECLAC, as the responsibility, is tasked with helping countries to track the accomplishment of achieving the famous Sustainable Development Goals, which, to rephrase as a famous Caribbean advocate, is supposed to go further than the MDGs, because the MDGs perhaps were the most distracting gimmicks. And so, because it did not have, the Millennium Development Goals did not truly have development in the center. The Sustainable Development Goals, we hope, will help us to do just that. And so in the review of where we are today, it has been quite well captured that countries in this century actually have enough or important high-level intersectoral institutions that deal with coordinating the agenda and the agenda's objective, which, as you know, is an advancement from the previous MDGs. But the important challenge that jumps out still for us today is the need to have information available to be able to produce the SDG indicators. And everyone has referred to that, not just today on this panel, but throughout the meet. And this we cannot emphasize enough. And so if we don't have the right data, if we have challenges today with measuring maternal mortality due to non-credible sources and information, this is a point that requires a lot of attention. And so the same report or the gathering brings to our mind that truly what we need are more effective and innovative policies that support and are supported by a gender equality architecture that's institutional. And that goes to the little video saying that political will shifts and thus the institutional responses are not often sustained. And for this, we need to have, just like data at the very forefront, we need to have the issue of participation, true participation, at the center of all that we do. So with that as our context, others have made reference. I merely bring another angle of that reference. Beijing plus 20, so I'm saying we're almost at plus 25, is a fine time to remind us of where we are. We have uneven progress. We do have that unequal progress and uneven progress with regards to the advances. But we have many advances, and we need to recognize them because they have come about due to the work of many sustained actions by different sectors. But in that regard, and you can read the report to have a better grasp, we measure from different angles. And so we're alarmed when sweeping statements position some countries as having arrived or arriving at true gender equality in our countries. No, the truth is that we have uneven advances, but we are far from being where we wish to be with a just society, and that the advances are going at a pace that is unacceptably slow. So if we agree to that as a group, then we would wish to say, and so then what do we need? We need to be reminded, as has been said, that women's right is really, for us to realize women's right, we need to have the highest attainable standard of physical and mental health. And this means increasing women's access to appropriate, affordable, and quality health care throughout the life course. And it's not just one angle, it is at different moments, at different time, and according to specific needs. Well, as we look at that then, we would want to see what we achieved as one of the, and what we did not achieve as one of the essential measurement of the status of women in our societies. And I choose to look at the maternal mortality rate. We failed in the region of the Americas to meet the goal for the reduction of maternal mortality by 75%, and with the adjustments done, a lot of science included to determine what might be some of the best measurements for our region, but none of our countries reached that mark. 3 countries came fairly close, but none of our countries actually. And so what are the implications for state when that measurement of development, the status of women, we cannot meet? And we ask the same questions. Where are we sustaining the rights? Are we advancing with regards to the complete rights, access to health, sexual and reproductive health, information, and treatment? So I leave that for reflection because that is also within the context of the wider social determinants of health. And when we look at the determinants of health, the social determinants of health and economic determinants of health, in the first day, the day after the budgeting exercise, we looked at some of the other key issues as we look at the structural determinants of health, poverty, employment, education, etc. And today our panel reminded us with things that sometimes we overlook with decent work. Access to education, etc., access to health services at the local level, primary healthcare services, we realize that they intersect, that these social determinants in health intersect, and with regards to another specific determinant, the issue of ethnic and racial inequities is an important way of looking at how they add up, how they intersect, and how they amplify. A lot of reference have been made to that. And the one we cannot overlook is the whole issue with regards to the issue of ethnicity and indigenous peoples, the issue of land, access to land, and the issue of violence associated to the defense of land and property. And so then, when we talk about from the health sector, what are some of the issues we should be concentrating on? For the Pan American Health Organization, since 2005, we do have a gender equality policy. All the member states in our region are a part of this policy, and the essence of the policy is the achievement of gender equality in the health status, health condition, and also in the development of health. So it implies an active role, women as agents, but also the wider society. It is mainstreaming, as I've heard yesterday a comment about what mainstreaming actually means for us. But the hard part of mainstreaming, since we recognize this for several years now, is that we are swimming upstream with mainstreaming. We are indeed looking at power imbalances. We're looking at a region that is grounded in inequalities. This region is recognized globally as one of the regions, one of the most unequal regions, and also where there are many, many challenges with regards to human rights and fragile democracies. And so that is why it is hard, and that is why we have to keep going at it. And at the Pan American Health Organization, we have chosen to then define more concretely how we respond to that with member states. And for us, we start by addressing the issue of gender equity in health rather than gender equality, because we see gender equality as the framework, which is wider, dealing with the determinants, but then we go specifically to the issue of equity. Equity allows us to look at the morality of the issue, the fairness, the justness. It means collective norms of a society. And so for us then, we concentrate on gender equity in the health sector, looking at having access to the best possible health according to needs. And that is equity for us, according to needs, for men, women, boys, and girls, and of course, LGBT persons. But the second component of fairness for a society, any given society, is not just access to, it is also removing the barriers which prevent that you have access to. And that part is very tricky, because one part tends to be, if I have more resources, I can have more clinics, I can have more physicians, I can have more access, better roads, etc. But in effect, we know that many dynamics with regards to health-seeking behavior are structured on gender roles, gender norms, etc. And so for us, this is very, very key, and we call this working on gender equity in health as a means to achieve gender equality in health and obviously gender equality for development. And so I've been asked to talk then a little about the whole issue of the resiliency, the responsiveness and the resiliency of the health systems. And that is an area that will not go away. We are bombarded, and there are times when events, occurrences, emergencies, etc., overwhelm the capacity of the health sector to respond. And in some cases last year, you already know, complete territories have been overwhelmed due to devastating occurrences. And in this idea, we do need to have our concept clear. Because there are different ways of looking at this. For us, it makes specific reference to the ability of a health system to be able to absorb, to be able to recover timely, to continue to provide needed services. And the idea is that we build capacities not just in the human resources. We look at how we manage, we look at how we coordinate, we look at how we bounce back to provide the core functions. So for us then, resilience is an attribute of a well-performing health system moving towards universal access to health and universal health coverage. The region of the Americas, as part of the wider World Health Organization, is the only region that has chosen to divide the strategy that all the countries have ascribed to for universal health coverage into two components: universal access and universal coverage. And there is obviously a conceptual positioning done there. And for us in this region, we are also one of the only regions of WHO where the issue of ethnicity and health is given special priority. And so that we should acknowledge, because that is moving closer to health for everyone, everywhere. And that is what we do. And so for us to do that, We need to address the issue of climate change, disaster risk reduction, and having a health for all, including the needs for women, boys, girls, and children, and men, from the perspective of our strategy for universal access to health and universal health coverage. A lot has been said about our strategy, but actually our strategy brings together what is well known in our region as health for all. Back in 1978 for Alma Ata, which was declared and stresses the idea of health for all based on primary healthcare approaches. That is the message, health for all. Today, under the strategy, making it have more meaning and giving more meat to be able to get to health for all, it has been approved by all the countries in our region without any objection. And it has been approved alongside our international health regulations mandate. And this is the issue of emergencies with regards to disease and disease outbreaks. You are well aware that Ebola is out in the Congo region, and it starts from very far, but tomorrow it can be very near. And that is the issue of emergencies and disasters. So for our capacity building idea of bringing together from all the fronts, we do need to stress on the 4 pillars of universal access and universal coverage. Number 1 is the idea of the concept then. With regards to comprehensive integrated quality health care, we're talking about universal coverage, With regards to universal access to health and universal health coverage, we start with the idea of integrated model of care that responds to the needs of the people, the individual, the peoples, and the community. And that idea is moving towards a model of care recognizing differentiated needs, and most importantly, based on rights, based on equity, and based on solidarity. And that gives us the idea of inclusion. For us then, this idea is models that are more integrated. The second one is that we have to have a system that's efficient, well organized, and somehow best uses the resources to address all the needs of the population. So it's a progressive idea, and it insinuates immediately a social protection scheme, a policy at each country level where we provide to cover for all those in a consolidated manner. The last two, are the issue of governance. We've heard a lot about that. We don't need to repeat that. The issue of stewardship from the Ministry of Health, the Secretary of Health, the health sector with the social security schemes, etc., and the governance. So the accountability is built into this approach, and the intersectoral action to address the social determinants of health. I won't wait until the end. I have a few more slides. I will put it up front with regards to the issue. Investing in health is key to build health system resilience, and we need to acknowledge that. So then, for us to also recognize the specific contribution with regards to disaster risk reduction, PAHO works with many partners. We're part of the agency system in our region. We are part of the United Nations, etc., and we also bring complements to the processes already described by some of our panel members. What we do in this regard, we are trying to push an agenda that place women as active agents of change within the process, and not just women, communities, the organization of women, etc., and many others. And we recognize that communities today are very migrant. The issue of migration has not been emphasized enough, but within inward migration, also from rural to urban and across borders, is another issue that has not been raised. But our idea is that we provide the tools. We're talking about tools that uses an index for us to then continue, as UNFPA has shared with you, and within the Sendai framework, for us to advance our actions. And we perhaps promote the strongest relationship is building emergency management teams, the EMTs that are ready and ready to move, to be deployed, to be part of the response before, during, and after events and disasters. So here I won't go into each one of them, with regards to the plan, we have a specific plan for disaster risk reduction approved by all member states. And of course, within that, the idea is to ensure that gender equality is well-centered, but we need to pull together all your experiences to be able to do it. And for us, the issue is that the safe and the smart hospital is our element for that. Many countries are using this material to design their policies, to assess where their hospitals are, and I believe it may have also been mentioned in the video from Cuba. There are many experiences. We heard lovely ones in this session, the one in Antigua and Barbuda. We have heard others. We know in Peru, in Ecuador, in Mexico. We have seen the way experiences are built. So I'm just putting up another one. I won't go into detail, but it's just this idea. This is a case study from Ecuador on the way in which they have addressed gender-based violence. After the earthquake, but the idea here is that it is addressed in a very wholesome way. It is not addressed after the problem was detected. It is addressed looking at it from what causes gender-based violence. It is a multi-causal issue, and it has a lot of impact, but it requires the presence of all, from changing the way in which you view imbalances in power, you manage aggression, etc., understanding what the needs are for the treatment, building responses that are open, available, etc., but also in this regard, looking at what those specific needs will be in the time of disasters, as UNFPA has outlined in the previous session. And one of the things about gender-based violence is that if you don't do anything about it before, you are sure to have limited responses during an emergency or an event. So the idea then of using this as data points back to what we have mentioned for improved responses, and so I won't go into that anymore, but rather look at another experience which looked at another approach to address this issue, which is a case study in Honduras with an Afro-descendant group, which is the new Wagacha platform for the roles of Garifuna women, where women have been involved doing a lot of the work that has been recommended, bridging local communities, women's network. Garifuna women have been developing a case study where they have become the bridge between national authorities and local authorities to be agents in the preparedness process for disasters. In this case, cleaning up beaches, etc., but the idea is forming a network with municipalities to be able to then be a part of the response designed to have inclusiveness for the needs of women with a gender-sensitive approach. And the end of that project is to improve and diversify the livelihood. And this is very key when we look. Build back better. I prefer to call it build and build back better, because we don't wait for the end with regards to communities, their needs, and their voices to improve. And perhaps it's getting late now, but perhaps one issue not emphasized enough is the idea that women and gender-sensitive approaches will teach us that women are not here to just then do what hasn't been done, or there's no one else to do it, and to do it in an unpaid way. Women are contributors as well, but women also have voices to improve the responses. So in that regard, then I will try to just go to the suggested recommendations for the parliamentarians here, and in general with regards to the processes to improve health resilience in events of emergencies and disasters. And I put 3, and the first one just says everything. What can I say? And if in reality it is retake the issue of mainstreaming at the national level of planning within all the sectors, ensure that it is with the Paris Agreement, it is with the Beijing Agreement, it is with the Development Agreement, the Universal Health, all of the agreements, ensure that it is smack in the middle of it. And if you haven't, then remember the Jamaica experience. They progressed and then they went back and revisited it. So that is the idea. But the second one seems simple and perhaps is the tallest order. It is improve women's access to paid employment and their income security through the life course. So this really is what we're talking about, turning things around. This is structural change. We have decent work, we have coverage, we live longer, we have our needs addressed, then we are truly a part of sustainable development. And that has to do with status and structural policies, as the experience with Minas Gerais from Brazil has taught us. So in this approach, when we build and we build back better, don't forget, we need to monitor, we need to map, and we need to count who is being left behind. And that is part of the recommendation, that we continuously use data to do that. Specifically, from a health perspective, then, I've just outlined that at the sectoral level, because we come together in different ways, we can do to continue the work forward. The idea of the preparedness for mitigation plans, national plans, the idea of surveillance, have our data, have our tracking, have our mapping, knowing what our vulnerabilities are, having some kind of accountability in place for that, making health services and medicines, safe medicines, available at the community level, the nearest local level, and establishing a responsible communication with our communities as far as the design of public health messaging is concerned. It is amazing with regards to the other part of disasters, the emergencies, new outbreaks and re-emerging diseases, that the surveillance is slow in picking up because there is political intervention with maintaining the information manageable for a period of time, when this can really change the outcome of emergencies and outbreaks. And so then, in doing this, you give priority to women, children, and adolescents, elderly. In other words, you know who are your groups that are being left out. And last but not least, I would say again, investing in health is key to building health system resilience. Thank you very much. I have left, Madam Moderator, outside a few materials that, again, can serve as examples, and I leave this photograph not as being cheeky, but really Zika came to our region, and it became a public health problem based on two issues. Because we had not done enough with regards to mosquito control, and second was we have not done enough with family planning. We put them together, and we had the Zika situation in our region.
Thank you very much, Cathy. The reality check on our own accomplishments or lack thereof in attaining universal access and universal coverage. I mean, it's important that we really do critically analyze where we have individually reached and recognize the importance of political will in ensuring that whatever advancements you make within one administration can be carried forward, so that at the end of the day, I mean, nations do attain the gender advancements that we seek. Now I will hold off on the questions because we do have a bit of roundtable work that we need to do. Each table has a particular topic. And I'd just like to, as a concluding remark, I mean, it is clearly necessary that we incorporate gender analysis to increase the effectiveness and measures to protect people from climate variability and change, including with particular emphasis on engaging women as key actors in disaster response programs. But I'm sure that any burning questions that you have, we may be able to capture them when we, following the roundtable discussions, when we make our presentations there. So I will hand over to moderator for the roundtable session. I'd like to say to you all, thank you very much. You've been an excellent audience, and look forward to excellent work in the roundtable. Thank you.
Thank you very much. Yes, so we are going to move into the round table, and we have lots of time, and we will work in a way to do, when we do the report back from the round table, some questions to these panelists, okay, and that way we kind of combine it together. But I do want to suggest, and I'm not giving us a break, but I'm giving you maybe even 5 minutes if you need to use the washroom and stuff as we kind of situate ourselves in the round tables, and I will let you know there is coffee and tea out there to bring back into the room, so don't stay, grab it, bring it back. but then you guys have the sustenance for the roundtable work, okay? So I would like to start the roundtable work at 11:20, okay? 5 minutes. That's what I